This case is an example of pigmented facial lesion in an elderly patient, a 72-year-old woman, so it's old age, presents with a slowly enlarging, regularly pigmented macule on her cheek. The lesion has indistinct borders and has been present for several years. The most likely diagnosis is lentigo maligna melanoma. This is the lentigo maligna melanoma, slowly growing pigmented macule over the sun-exposed areas, particularly the skin of an old age. Another one, slowly growing pigmented macule over the face of an old patient. Lentigo maligna melanoma. Why it is important to diagnose the lentigo maligna melanoma or melanoma of the skin? To expect any metastases from the malignant melanoma. The common size for metastasis from malignant melanoma is the liver, the spleen, the stomach. So here, this is a splenic metastasis from malignant melanoma. This patient, this is a 60-year-old female with a skin lesion, which is expected to be melanoma. And now this is a contrast-enhanced CT scan of the abdomen, axial contrast-enhanced CT scan of the abdomen showing a hypoattenuating mass with irregular borders and central necrosis located in the anterior aspect of the spleen, most likely malignant melanoma, splenic metastasis. This is another case of metastatic disease from malignant melanoma. 67-year-old man with previous history of prior resection of superficially spreading skin melanoma. Now complains of dysphagia and hematemesis. So these are the upper gastrointestinal series. Shows a mass along the greater curvature of the stomach. This is the lesser curvature of the stomach. This is the incisura angularis, lesser curvature, and this is the greater curvature of the stomach. There is a mass with irregular margins along the greater curvature of the stomach with several irregular collections of barium along the mass. Several irregular collections of barium along the mass correspond to ulcerations. So this is gastric metastatic melanoma. Metastatic deposit, gastric metastatic deposit from malignant melanoma. Another case seen here. This is axial contrast-enhanced CT scan of the abdomen at the level of the upper liver and the spleen, showing a target lesion target enhancing lesion in the right lobe of the liver. Target enhancing lesion in the right lobe of the liver. There are at least 3 other subcentimetric liver lesions. 3 other subcentimetric liver lesions. These lesions indicate multiple target lesions of the liver, multiple target enhancing lesions of the liver, suggesting metastatic disease of the liver. Free fluid is seen in the right upper quadrant. Free fluid is also seen in the right upper quadrant. So this is a differential diagnosis of target liver lesion. Target liver lesion. The first possibility is metastases. Target liver lesions equal metastasis. Maybe multiple hepatic cell carcinomas, hepatic lymphoma, hepatic abscesses. Metastasis is the most common tumor and malignancy of the liver. The most common source of metastasis to the liver is melanoma. The most common source of metastatic disease to the liver is melanoma. Then lung, breast, pancreas, and colon. Metastatic lesions can have peripheral rim or target-like enhancement. Peripheral rim or target-like enhancement. Metastasis is more than 10 times more common than primary liver malignancy. The liver is the most common site for metastatic disease. So now we have talked about the malignant melanoma. Let's talk about the other possibilities which were incorrect. Seborrheic keratosis. This is an example of seborrheic keratosis. So, seborrheic keratosis has a stuck-on appearance. This is the seborrheic keratosis, and this is the stuck-on appearance. Stuck-on appearance of the seborrheic keratosis. Stuck-on appearance. Stuck-on appearance seborrheic keratosis. Stuck-on appearance. Okay. Actinic keratosis is typically erythematous and scaly. This is the actinic keratosis. Erythematous, typically erythematous. This is the actinic keratosis, which is typically erythematous and scaly. Erythematous and scaly lesion, skin lesion equals actinic keratosis. Erythematous and scaly skin lesion equal actinic keratosis. Then the last one is pigmented basal cell carcinoma, which has rolled edges and ulceration. This is a pigmented basal cell carcinoma. It's pigmented with rolled edges. Can you see the rolled edges and the ulceration in the next image? The first image showing the pigmentation and the rolled edges. The second image or the image below shows the pigmentation and the ulceration. Pigmentation. This is the ulceration and the rolled edges. Rolled edges, pigmentation, and the central ulceration. The ulceration, broad edges pigmentation. This is pigmented basal cell carcinoma. So let's talk about the basal cell carcinoma. It's a part of basal cell nevus syndrome or Gorlin syndrome. Basal cell nevus syndrome or Gorlin syndrome. So once you see the basal cell carcinoma, pigmented basal cell carcinoma, you need to consider the basal cell nevus syndrome. Can be a part of a syndrome called Gorlin syndrome. So this patient is a 10-year-old girl with incidental finding on a routine dental X-ray. So skin lesion can make you consider the basal cell nevus syndrome. Dental lesion can make you consider basal cell nevus syndrome. So let's see this dental lesion. CT scan images of the face demonstrates multiple expansile. Let's make it larger. CT scan images of the face demonstrates multiple expansile cystic-like lesions in the maxilla and the mandible. Yeah, these are the multiple expansile cystic-like lesions in the maxilla and the mandible with smooth borders. These lesions demonstrate smooth borders. Smooth borders. Smooth borders. The lesions demonstrate smooth borders. Cystic-like lesions with smooth borders. They are multiple. Non-contrast CT scan of the head shows extensive dural calcifications, which is abnormal at this age. CT scan of the head shows extensive dural calcifications. So these are the extensive dural calcifications on non-contrast CT scan. Another one, extensive dural calcifications on the non-contrast CT scan. Basal cell nevus syndrome, also known as Gorlin syndrome, is a syndrome due to mutation in the PTCH tumor suppressor gene manifested as multiple jaw cysts. So the multiple jaw cystic lesions are odontogenic keratocysts. Odontogenic keratocysts. These lesions are diagnosed by multiple cystic lesions with a smooth border seen in the mandible and the maxilla, cyst-like lesions. Okay, so these are odontogenic keratocysts. Odontogenic keratocysts. Mandibular odontogenic keratocysts. Maxillary odontogenic keratocysts. Okay, this is associated with dural calcifications and multiple basal cell carcinomas. So, skin lesions, mandibular lesions, and the dural calcification equal basal cell nevus syndrome. So this syndrome can be considered by the skin lesions and the mandibular lesions. And if this patient has a non-contrast CT scan, you will find dural calcifications. They may be associated with medulloblastoma of the cerebellum. Can be associated with other features as fused or bifid ribs, ovarian fibroma. Can be associated with osteomas and fibromas, bifid ribs. Okay. Patients may present with jaw pain, jaw deformity. Odontogenic keratocysts are expansile cysts in the jaw with scalloped borders. Expansile cystic lesions in the jaws with scalloped borders. They may have areas of higher attenuation within them due to proteinaceous or hemorrhagic content. They may displace or resorb the roots of the teeth. Management: patients need periodic dermatologic screening. This patient needs dermatologic screenings and treatment for the basal cell carcinoma. So this is the most important part. The associated basal cell carcinoma is very important. So this patient needs periodic dermatologic screening and treatment for basal cell carcinoma. MRI examination may be performed to assess for medulloblastoma. Okay. The odontogenic keratocysts can be surgically excised with very high rate of recurrence. Okay. So the odontogenic keratocyst can be surgically excised. The basal cell carcinoma should be screened for. And medulloblastoma also should be screened for. Okay, that's it.